Hello YouTube, I'm Dr. Fox. Today, I'm talking about struggling to conceive. Please check this video if you are concerned that either you or your partner is infertile. If you have any doubt about your own fertility or that of your partner, you would benefit more from learning about the factors that influence fertility and how you can use this knowledge to enhance your chances of conceiving. Okay, let's get started with the menstrual cycle. Understanding fertility commences with understanding your menstrual cycle. Over the course of your cycle, which is an average of 28 days but can span from anywhere between 21 and 35 days, your body gets through some significant changes that are associated with your chances of getting pregnant. You can only get pregnant when you are ovulating. Ovulation typically takes place between the 30th and 20th days of the cycle. However, every woman is different and not all women exhibit a clear pattern in terms of their ovulation. After ovulation, every woman will have a period within 14 to 16 days unless she has a health problem that affects her periods or becomes pregnant. If you're actively seeking to get pregnant, you should chart your ovulation. This will enable you to identify the times during the month when you are most likely to get pregnant. Okay, as I mentioned, being aware of when you're ovulating can help you to plan your pregnancy. There are several methods available by which you can try and predict ovulation. These include first, basal body temperature method. Your basal body temperature is your resting temperature first thing in the morning. When a female is ovulating, her basal temperature increases slightly. As such, by monitoring your temperature over several months, you will be able to predict what days of the month you are most fertile. Basal body temperature differs from person to person. The average temperature before ovulation is around 36 degrees Celsius. Some women experience a sudden increase in their basal temperature before ovulation, while others exhibit a gradual increase over several days. It is typical for a woman's basal body temperature to increase by only about 0.3 degrees Celsius during ovulation. As this increase is fairly low, you will need to use a special basal body thermometer, which are extremely sensitive. They are available from most drugstores and usually not so expensive. While the increase in the basal temperature will not directly coincide with the release of an egg, most females ovulate within 3 days of the spike in temperature. Their body temperature then remains at the higher level until their period commences. You will be at your most fertile and therefore most likely to get pregnant in the following conditions. First, 2 to 3 days before your temperature peaks, which marks the moment of ovulation. Second, 12 to 24 hours after ovulation. These may seem like two very different time periods. However, male sperm usually can survive for up to 3 days in the woman's body. Therefore, it can fertilize an egg at any point during those 3 days. That means that having unprotected sex 2 to 3 days before ovulation can lead to pregnancy. While tracking your basal temperature can be a very effective way of predicting ovulation, it's important to be aware that this method is not always entirely accurate, as other factors could influence your body temperature. These include the following. First, inadequate sleep. Second, drinking alcohol or smoking cigarettes at the night before. Third, illness or fever. Last, performing any task before taking a temperature reading. For example, using your phone or going to the toilet. Okay, the next is the calendar method. To follow the calendar approach, you need to record your menstrual cycle on a calendar for 8 to 12 months. The day your period starts is day 1. Circle the date on the calendar. You should then track how long your period lasts. Bear in mind the fact that your cycle may change from month to month. Therefore, you should record the number of days each period lasts. You can then use this information to plot when your ovulation is most likely to occur. To find out the first day when you are most fertile, subtract 18 from the total number of days in your shortest cycle. Take this new number and count ahead that many days from the first day of your next period. Draw an X through this date on your calendar. The X marks the first day you are likely to be fertile. To find out the last day when you are most fertile, subtract 11 from the total number of days in your longest cycle. Take this new number and count ahead that many days from the first day of your next period. Draw an X through this date on your calendar. The time between the two X's is your most fertile window. You should combine this approach with additional fertility awareness method, especially if your periods are not always regular. Okay, last is the cervical mucus method or ovulation method. The ovulation approach involves monitoring changes in your cervical mucus throughout the course of the months. The hormones that your body produces during different types of your cycle also control the amount of cervical mucus your body produces before and during ovulation. Immediately after your period, you will have a few days when your body produces little to no mucus. As the egg matures, the amount of mucus your body produces increases and changes constantly so that it is clouder and thicker. The largest amount of mucus is produced just before ovulation. During these days, the mucus resembles raw egg whites and is sticky. The mucus is produced at a time when you are most fertile. After 4 days, the mucus will change again. The amount of mucus the body produces will reduce, and you may have a few days with no mucus at all until your period commences. Track the changes in your mucus on a private calendar. You can potentially label the days sticky, dry, or wet. Your period of fertility commences at the first sign of wetness after your period or a couple of days prior. The cervical mucus method doesn't work for everyone. Women who are breastfeeding, taking birth control medication, have sexually transmitted diseases, use female hygiene items, or have had surgery on the cervix should not rely on it exclusively. To track your fertility accurately, combine the methods I mentioned. This approach is known as a Symptothermal method. You can also buy ovulation kits or fertility monitors from the drugstore. Like pregnancy tests, these work by detecting hormones in your urine. In this case, the luteinizing hormone which triggers ovulation. Okay, thank you for watching. See you.